Karl. I'm a mechanical and electrical project engineer. I live in Halesowen, West Midlands, and outside of that I am a martial arts karate instructor. I initially came to the BMI for a consultation due to a back injury that I sustained basically getting out of bed after a training session the week before. I did some research on where the back injury the specialist was and found that the consultant best suited for what I thought was my injury was here at the BMI Priory in Birmingham. Being a sportsman, it was important to me to have the best treatment available possible and to minimise the time and the recovery that I would need to continue doing what I do. On my first initial consultation with Dr. Ishaque, we found out that we had common interests: skiing, karate, both things that are detrimental to a back, and he just put me at ease straight away with, right, I'm going to do this, I'm going to do that, we'll try this, and straight away the whole team around him, how he said he would interact all the way through. He phoned me, his secretary phoned me, everything was staged and done as he said it would be done. The procedure that I had done was a bilateral injection, and that is an injection into the disc itself, not where I thought I might have needed surgery. So rather than having the traditional cut you open, mend it, fix it, do what you do, the surgery was pioneered by Dr. Ishaque, which was 2 injections, top and bottom, left and right, directly into the disc itself. That then aids recovery, which is a must being a sportsman and how active I am and competing at an international level. All the staff here at the BMI, they all take their jobs very, very seriously, and they're very, very professional. From the moment I was wheeled into the room by the porter, they come, they have the chat, they put you at ease, you get introduced to the registrar and the anaesthetist. That was fine. They told me, hi, I'm so and so, I'm now going to put a needle in your arm and I'm going to make you go to sleep. The next thing I know, I am waking up in a recovery. The nurses, the ITU nurses, or whatever they are exceptionally. They're monitoring you constantly, asking you questions. Are you okay? Do you feel drowsy? Do you need a drink of water? And then once you've done all of that, they then send you back to your room, which again, it's all prepped for you. They ask me, do you want a sandwich? What would you like to eat? You have to eat because it's part of their protocol. But from that, they turned and said, right, 20 minutes, do this, do that, have a wash, make sure you go to the loo, and then we'll have some food. Once you've had some food, kept it down for 30 minutes, we'll let you go. But during that time, every 10 minutes, the nurses were popping in, are you okay? How are you? Things, it was absolutely excellent. The service, is better and beyond of what I expected from this. Since having my injury and being a sportsman, I thought that my martial arts competition days were a thing of the past. And within a series of injections over 6 months, that enabled me to compete in the English Championships, the Irish Championships, and then further since then being selected to compete for England at world and European level, all in the same year. So within the space of just over 12 months, I've gone from feeling I'm never going to compete again to competing at the highest level that I can.